Hi, I know you know what this is. Yeah, Advil, Ibuprofen. Most people know what it is. You probably have one of this sitting in your house right now. But before you pop this bottle of Ibuprofen, do you know that there are certain things that you shouldn't mix with Ibuprofen? Yeah, I'll tell you about it. First off, you should never mix ibuprofen with certain medications. For example, you should never mix your ibuprofen with other NSAIDs. That's like your diclofenac, your aspirin, your naproxen. Don't do that because doing that can actually cause damage to your stomach lining. And if you have ulcer, you're even at more risk because it can actually lead to internal bleeding and more GIT disturbance. Another example of medications you should never mix your ibuprofen with are blood thinners, okay, like your warfarin, your Xarelto. Do you know that one of the common side effects of blood thinners is actually bleeding, minor bleeding? Yeah. Now imagine mixing ibuprofen with your blood thinners. Of course, it's going to escalate the bleeding situation. Another example of medications not to mix your ibuprofen with are certain antidepressants like your citrulline. Doing that can actually increase the risk of bleeding. Then again, you should never mix your ibuprofen with your blood pressure medications. Doing this can actually weaken the effect of the blood pressure medication and cause you liver damage in the long run. Mixing ibuprofen with alcohol is a no-no. As a matter of fact, you shouldn't even mix alcohol with any medication at all. Now, do you know what happens when you mix ibuprofen with alcohol? It leads to disaster. First off, it's going to irritate your stomach lining and it can cause heartburn and even lead to ulcer if you don't already have it. Secondly, doing that can actually lead to liver and kidney damage in the long run. Thirdly, doing that can actually lead to severe dizziness and drowsiness, and it's actually very bad for you if you're driving. Another thing you should never mix your ibuprofen with is certain foods and supplements. Now, for an instance, if you're taking food that are high in potassium, like banana, your kale, and your spinach. This combo, and in addition to blood pressure medication, can actually lead to high deposits of potassium in the body, and in the long run, it can affect your heart rhythm. If your supplements like ginkgo, garlic, and fish oil, please ensure to talk to your doctor before taking ibuprofen because mixing ibuprofen with these supplements can actually yield undesirable health issues for some people. Now, the use of ibuprofen might not be advised if you have certain health condition. For example, if you have ulcer, okay, ibuprofen is a no for you. As a matter of fact, ibuprofen should not be prescribed to you if you have stomach ulcer. Then again, if you have heart disease or high blood pressure, you should not take ibuprofen without consulting a doctor because taking ibuprofen without any medical advice can actually lead to heart attack or stroke. Thirdly, if you have kidney problem, ibuprofen is not advised for you because doing that can actually reduce the flow of blood to your kidney, hereby worsening your condition. In case you're wondering, if I don't take ibuprofen, how am I going to numb my pain, my cramps? See, there are safe ways to actually take ibuprofen. Number one, take it with food or milk. Doing this can actually reduce the risk of your stomach getting irritated. Secondly, stick to the lowest dose for the shortest period of time. So ensure not to overdose on ibuprofen and make sure you stop taking it the moment the pain disappears. Thirdly, please consult your doctor before you take ibuprofen. Oh my god. Consult your doctor is very important, especially if you're not sure if it's safe for you or not. And lastly, please check your medication labels, okay? Because some medication they actually contain ibuprofen, okay. For example, medication for cold and flu, some of them they contain ibuprofen, so please read the label and ensure that there is no ibuprofen present in that medication. Your body is not a chemistry lab, so please don't mix up things without knowing the risk. If you are not sure, ask questions, talk to your doctor, talk to your pharmacist, talk to any healthcare professional. All right, thank you for watching this video. Please don't forget to subscribe to my YouTube channel, okay, and please follow me on TikTok and on Instagram for more healthcare tips. Bye.